Hey everybody, it's Joe Buffington with RE/MAX Realty Center. I'm doing my 30 favorite places in 30 days, and today I got the opportunity to interview Dr. Paula Bourelly, a dermatologist at MedStar Montgomery Hospital. Well, if you're ever on Final Jeopardy and you get the question, what's the largest organ in the human body, you will know the answer after watching this interview. So take a look at this interview. You'll get to learn a lot about a great doctor in our community, but also a great person, someone who's a great mom, great wife, and a great friend to many of us. So check out this interview. I know you'll love it. Bye-bye.
Hey everybody, it's Joe Buffington with RE/MAX Realty Center. I'm doing my 30 favorite places in 30 days, and I'm here with Dr. Paula Bourelly. Paula, tell me a little bit about your practice and how are things going?
Well, hi, Joe. Thank you for having me. I am a dermatologist in private practice. I'm right here at Montgomery General Hospital, and I've been out here in the Olney area since 2005. 7 years prior to that, I worked in DC in the Georgetown area, and I was on staff at Georgetown Hospital. So in my practice here in Olney, I kind of cover the full spectrum of dermatology. I do some surgical derm, I do a lot of medical derm, a lot of acne and eczema, and then I do cosmetics as well. So some of the typical things that people know about: fillers, chemical peels, laser hair removal, and even body sculpting. Yeah, so it's been great to be out here. We moved out here maybe 15 years ago, not knowing anyone. And so I was a little nervous about how I would take any of my DC patients and bring them this far up Georgia Avenue. But I've developed a community out here through sports and schools with my kids that I get to take care of not only people I don't know, but a lot of people I have a social relationship with too. And so now this is my community.
With dermatology, what are the hot buttons right now? What are things you're treating a lot now this time of the year that you don't normally treat?
Well, I have to tell you, certain things are seasonal. There's no doubt about that. So
Okay.
kind of standardly, I'm always treating acne. I'm always treating psoriasis. I'm always treating skin cancers. That's pretty much across the board. The things that tend to flare up during certain seasons are things like eczema. So when the seasons change and a lot of these allergens that make you sneeze and make your eyes water will frequently also cause your skin to start itching. And people who are prone to eczema will come in during this time. They might even come again in the fall when the season goes from warm to cold. I'll tell you, interestingly, with the pandemic that we're all facing now, I've had a number of people come in with various rashes that we know are exacerbated by stress.
Oh, wow.
So I've had several cases of shingles. You know, people are familiar with that. I've had several cases of people who have a condition called seborrheic dermatitis, which is flaking and scaling in the scalp, kind of like a dandruff. It can affect your face also, but it's definitely made worse when people are under stress. And so those are changes I've seen clinically in my practice. Structurally in my practice, of course, for a period of almost 2 months, we closed our office to inpatients. We had to see a few people sort of urgently, and we would allow them to come in, but the vast majority of our patients, we turned them into what we call telederm or
Okay.
telehealth virtual visits. And so just like you and I are Zooming, we would have video chats. And one really nice thing about dermatology is we're taught you don't have to talk too much to the patient, but you have to really be able to see them. So you look first, and then you can ask the question about what's going on. So as long as people can get me a good picture and then give me a history afterwards, many of these conditions I can diagnose, just virtually. And so that's been a blessing. And frankly, I think it's been really helpful, particularly for my patients who come a great distance, to have that as an option. I even have patients out of state who I haven't been able to see for a while because they've either moved or, they're coming back from school. So opening that up has been tremendously helpful for the structure. What we're doing now, we just officially opened up our office about 10 days ago. And just some of the changes we've made to make sure that we're compliant with the CDC recommendations. We schedule the patients now at a much longer interval in between each patient so that we have time to, wipe down the rooms and make sure everything is sanitized before the next patient comes in. We have people wait in their cars until we're ready for them so we don't have traffic in our waiting room. We do temperature checks just to make sure that if there's any sign that maybe they've been sick, and this is after we've already done our screening questions, we can pick that up before we have somebody come in the office and possibly be sick. And then we as staff wear masks all day long. And we also adhere to the same policies. If you're not feeling well, don't come into work. And we're constantly checking check in on that.
Okay. So how often should someone see their dermatologist?
So what we recommend for everybody, the general population, is that you come in once a year and you have a complete skin exam.
Okay.
And many people might say, well, that's okay because I see my primary doctor and he or she does that. And I would say if you have a really, not a really good one, they're probably mostly all really good. You have to have someone who's really comfortable evaluating moles. And I would say that might be where you don't have as many people, right? So even if you're getting a skin check by your primary care doc, oftentimes we want to see you too because we're looking for different things once a year. Now, if you've had a melanoma, if you've had a basal cell or squamous cell, these are the cancers, then we like to surveil you a little more frequently. For melanoma, it might be every 4 to 6 months, depending on how far in their history the melanoma was. If it's a basal cell or squamous cell, again, depending on what they have on their body at the time that I see them, if they have a lot of precancers that I think need to be evaluated and treated so they don't evolve into basal cells, I'll bring them in more frequently. But just as a matter of course, once a year is probably good.
Okay. Well, if someone wanted to schedule an appointment with you, how does that look? How do they do that?
So, I mean, the easiest way is simply call the office and let them know you want to be seen. And I have staff here. Even while we were closed, we had staff here, manning the phones, and that's been really helpful. We also do take online appointments. So if they go to our website, they can see the whole process for how you schedule.
What is that website?
It's www.olneyderm, so OLNEYDERM.com.
Okay. And what's your phone number, Paula, for people to schedule appointments to?
Wonderful. It's 301-260-9202.
Great. Very good. Anything else you want to tell people about your business before we go?
I would simply say that I enjoy taking care of the community. So if people want to come, I'm happy to see them. I do think that the skin is the biggest organ you have, and so it's never too early to start taking good care of it. And we'd be happy to take care of them.
Right on. Can you do anything for these
Yeah.
groceries?
We're going to talk about that when I hang up here.
Thank you very much, Dr. Paula Bourelly.
Yes.
With Olney Dermatology, and look forward to seeing you soon.
Thank you, Joe.
All right.
Take care.